I am Angela Anthony, and I am an associate professor here at Eastern Illinois University.
I am Beth Bergstrom. I am an instructor here at Eastern Illinois University. My primary job is clinical supervision, but over the years I have picked up some junior level courses and some special topics in the areas of pediatric feeding and cleft palate, developmental trauma.
I'm Sigmon Hernandez. I'm a clinical instructor here in the department.
My name is Becker. I am a professor here at Eastern, and I do both clinical teaching and classroom teaching, as well as part administration. So I'm the clinic director of the EIU Speech Language Hearing Clinic. I would say right now it is any of the materials from the social thinking series on pragmatics. They have so many new materials, and the information is really just digs into some of the nuances of pragmatics that are very useful with clients.
I love a book. Go Dog Go is my favorite therapy material. I can literally target every single goal just by using this book, whether it's concepts or vocabulary or pragmatics. I can do it all from this one book.
One tool that I recently added is the Bergstrom speech sound cue cards. They have been an awesome resource for articulation and speech sound intervention.
My favorite therapy material of all time is a book. I feel like you can do so much with a book with various levels of clients. You can do so many different language and speech activities. It's really one of the most flexible therapy materials, I think. Well, I'm here in the university. I've been here for a while, and it really is my favorite place to work. I think it's I'm always learning. I'm always exposed to people who have knowledge that I don't have, and it's just a great place to be on a daily basis.
I love all settings. Wherever I am currently working is usually my favorite setting. I love anything from home health to early intervention to the hospital and the university setting.
I love working in the clinic. A close second would be early intervention, home-based therapy with young children.
I love to work in early intervention or early childhood pre-K. That's where I worked prior to coming to Eastern, so I love working with the little ones. Anything early language, early speech. I think that early language also falls into AAC because I love to teach those beginning language skills to clients, both verbal and nonverbal.
My college roommate was a speech pathology major, and I was not, and she was having more fun than I was. So my junior year of undergrad, I switched into speech pathology.
I got into the field because it's such a diverse field. There's so many different ways you can work with clients in the field and just different things you can do as a speech language pathologist. I've always been driven to work with children, especially children who needed additional supports that they weren't getting other places. So I feel like this field really marries together a lot of different other fields like education and working with children with diverse needs.
My parents are both teachers. And so I was interested in the education piece, but I didn't want to be a classroom teacher. Look at me now, here I am now teaching in front of classrooms. But I wanted more of that one-on-one, and I think that led me to finding speech therapy. I remember shadowing when I was in high school, our speech therapist at our local school, and that got me interested in it, and I'm so thankful that it did. I love that I get to teach students, yet I still get to interact with clients and their families through supervision, and that I just get to be really hands-on with students in the classroom and in clinic. I have had some opportunities to visit other universities, and this is one of the most collegial places that I have ever been, and I just love that everybody is so collaborative, and I can walk down the hallway and ask someone a question if it's an area of knowledge that I don't have or that I need more resources in. It's just great to have collaborators up and down both hallways. But I think in this one, I think about what sets it apart for students, and I think it is that because we're so hands-on, we do lots of case-based teaching, lots of practical, clinically based teaching, and we really focus on making sure that students walk away from our program with a good understanding of what it's going to be like in the clinical setting. So we're not just focused on theory and book learning, but really applying that information in our class.
Yeah, I think it goes back to the two things that I love about this setting: the diverse, complex cases that we get, and the collaboration that we get to show our students how, you should never work alone. You should always be brainstorming and collaborating and consulting with other professionals, not just SLPs, but maybe the audiologists. We learn something from them all the time. In other settings, you may not get the chance to do that because of a time crunch or because there aren't any other SLPs maybe close by, but here we get to do that on a daily basis, and it's my favorite thing.
I feel like I'm truly making a difference every day that I'm here, and it's we work with a lot of clients who are referred to us by caregivers or providers who are facing great challenges, and they know that the EIU clinic has a reputation for excellence, and it's a place that they trust to refer kids and adults who have complex communication needs, and they trust that we will be able to support them. The department has a wonderful team atmosphere. There are so many opportunities to collaborate and continue to grow professionally, which it offers really the best of all worlds out there for me personally. I think how closely we work with our graduate students is very unique about EIU. We have a very accessible open door policy. We invest a lot and spend a lot of time working with graduate students in developing clinical skills. We have weekly conferences. We're very accessible. We supervise sessions, I think, far above the minimum requirements, and that just shows our investment in helping clinicians not only learn the science behind what we do, but also develop and hone clinical skills so that when they leave for internships and they leave to work out in their job placements, that they have developed those skills necessary to hit the ground running.
The people, hands down, the people. The faculty here are just truly amazing. The department has a long history of being a quality program. I went to school here at this program, so the faculty at that time were amazing, and they still are. So I would say definitely the people. I feel supported every day that I'm here. All of our faculty are wonderful collaborators, and so I know that I can go to anyone at any time for anything. We're great teammates, and we don't stand alone, so feeling supported is really important in your job. I think they try every day to, do the best that they can, and we're constantly problem solving. We're constantly, thinking about new ways and best ways to teach our students, and so we're never stale. We're always moving forward, I think, and I think that is definitely a hallmark of our program, is that the fact that we are, we don't let anything just sit. We're constantly thinking about new things and new ways to teach and new ways to improve. And I think we are really invested in our students. I think we're a big family up here, and we're all very caring, and that makes us pretty special that we're that close-knit of a group, that we care so much for our students.